Good morning, Miss.
Yes, good morning. You are Tikah Aprilia, right? Okay. I am Zilia manager who is responsible for today's interview. I will ask few questions. Tell me about yourself.
Yes, I am Tikah Aprilia, graduate from the Tasikmalaya Health Polytechnic. I am timely and responsible person. I'm happy to be concerned to help people when they really need help.
Position you are applying for.
I saw in a job opening that this hospital need a nurse to apply a position as a nurse.
Why did you decide on a career as a nurse?
Because I really like help, especially when caring for people. I really like it. And I like it when someone tells me about complaint of pain.
Okay, Tika. Tell me what you feel your greatest skill as a nurse is.
I have the skill to manage patient pain when a patient feels worse or stressed because of the pain that is felt. These skills I once did when I practiced at Arjawinangun Hospital. The way I will listen to all patient complaints and always respond what they say. I will tell patient to take a deep breath, provide motivation to recover. The patient's family also need to practice to encourage the patient.
When you stress in your job, how do you handle the stress of the job?
From my experience, the stress comes when many patients come that day, and all care must be fulfilled, while the nurse must take turns. My way of relieving stress is when I'm resting. I will stretch my body and I eat sweet food.
What do you find is the hardest part about being a nurse?
The hardest thing I felt was being a nurse when could not make patient calm before the pain.
Why do you want to work here?
I like this hospital. By working here, I can acknowledge that I have never gotten before.
Are you comfortable working with other doctor and nurse?
I think working with doctor and other nurse is something that should be done because that way the patient will recover quickly. Experience, there are nurses who can be invited to work with others who feel more comfortable doing their own work. So we must understand the character of colleague.
Why should we hear you?
When a patient don't want to do nurse action because of hair, then I as a nurse must explain the procedure well and reason why the action must be done is for patient's recovery. I'm a person who can blend in with the environment, and I'm the type of person who is easy to make friends with anyone. From my experience, there are patients who don't want to be infused because they feel afraid to the syringe. So I will divert the patient attention so that they still want to be put on an IV because if they are not put on an IV, the patient will lack body fluid.
Why should we hear you?
I have the skill needed at this hospital. I am a hard worker. Working here, I can improve my skill in nursing, especially in patient care.